Hello everyone and welcome. Today we're going to be talking about Module B, which is infection prevention. We are going to talk about the chain of infection and how it relates to our work as nurse aides in long-term care facilities. We're going to talk about how we can break the chain of infection and why it's important. We're going to talk also about standard precautions and transmission-based precautions so that we understand the difference. And going along that route, we're also going to be talking about personal protective equipment, or PPE, that we may be using. And we're going to finally talk about why long-term care residents are at higher risk than a lot of the general population for infection. So infection prevention, what that simply means is how we control and prevent the spread of infection. An infection is a disease or condition of the body that occurs when a harmful germ gets into the body and then it grows, multiplies in number. Some examples, and some of you are probably familiar with, a urinary tract infection or UTI. That can be a bladder infection or a kidney infection, skin infections like wounds or cuts, respiratory infections like the common flu, pneumonia, or the common cold, and gastrointestinal or GI infections. That could be a variety of things, stomach infections, intestinal, or food poisoning even. Now, something that we need to know, there are two types of infections. There's localized and systemic, and let's talk about those a little bit here. So a localized infection is an infection that's found in one part of the body, and the symptoms are limited to that one part. So you see this picture here. This hand, it's got a spot that's infected. It doesn't go beyond this location. So how many of you have ever had a little infection on the side of your fingernail? It's called a paronychia, where that right where the fingernail edge is, it gets swollen, red, hot to touch, may have drainage or pus. So that's an example of a localized infection. A systemic infection, on the other hand, is something that affects the entire body or an entire body system. When we have a systemic infection, we might see things like fever, chills, fatigue, nausea or vomiting, sometimes confusion even. And again, this can be related to the entire body or body system. Some examples, a respiratory infection. It affects our whole respiratory system. So we might see some of these things like fevers and chills, coughing and sneezing, mucus production, right? When you cough things up, sniffling, kind of, sneezing. I think I said that one already. And we're going to talk a little bit about now, that was a bladder, or excuse me, not bladder. That was respiratory infection. Now let's mention some common things that we see with a bladder infection. With bladder infections, or if you've ever had those, a lot of times you have pain during urination, can feel like it's burning. We could have fever and chills. Our urine may have visible blood in it, it may not. It may also be more concentrated, dark in color, and strong smelling. There's a strong odor to it. You may also, if it's gotten beyond the bladder, you may also have pain in the lower back, where we call the flank area. So stomach infections. A lot of times when we have an infection going on in our stomach, we have pain, discomfort, cramping, nausea, and vomiting. And those are just some examples of when we have an infection in a particular body system. Now let's back up a little bit here and talk about microorganisms. Microorganisms are another word for germs. Germs, of course, live almost everywhere. They're inside our body, they're outside of our body, and it's important to know that some microorganisms or germs are helpful. We need some of them, like in our gut. We need certain microorganisms living in our gut for it to function properly. But there are some germs or microorganisms that can cause disease. And that's the ones that we're concerned about learning how to prevent the spread of infection, right? So all microorganisms need certain things to survive, just like us. But microorganisms in particular need warmth, moisture, tissue to feed on, and microorganisms that are aerobic oxygen, and microorganisms that are anaerobic do not need oxygen to survive. Another term that you want to be familiar with is medical asepsis. You may also hear this called clean technique. Medical asepsis or clean technique is simply the practice that we do, or practices, I should say, that we do to remove or destroy microorganisms and prevent them from spreading, whether that be from spreading from one person to another person, or from one person to another place, or from place to place. And I mentioned we were going to talk about the chain of infection. So this is something that's been we use to explain the spread of infection and how we can break or stop the spread of infection. So the chain of infection is really important. And it's important to know that there are 6 links in the chain of infection. Each link in the chain of infection represents something or someone that's needed to pass an infection from one to another. So for an infection to occur and spread, each of these 6 links that you see in this image has to be present. If the links are present, if they're joined together, the infection will in fact be passed on. So if we can break even just one link in the chain of infection, we have prevented a new infection from spreading. Infection prevention practices include hand washing, cleaning equipment, using a mask, etc. And we'll talk more in detail about those. We're going to talk about each individual link now. So the first link is the causative agent. This is a harmful germ or microorganism that causes an infection. Some examples: bacteria, fungus, parasites, or viruses, right? The second link in the chain is the reservoir. The reservoir is basically a home for germs. It's where the germs live, grow, and multiply or increase in number. When a reservoir is a person, the harmful germ can live in a few different places. Germs can live in our blood, our skin, or I should say on our skin, in our digestive tract, in our respiratory tract, like our throat and our lungs, for example. So a reservoir can be a person, like I just mentioned, but it can also be an animal. The dirt could be a reservoir, water, or just other places in the environment. So that's important to remember. So a question to ask yourself is, can you look at a person and always tell if they have an infection? The answer is no, not always, right? So we can have an infectious germ living in or on our body, and we're not showing any signs or symptoms of being sick. So we can think of people as reservoirs for harmful germs in these 3 different groups. The first group is people who are not infected, they're well, and they don't have the germ, so they don't have this infectious germ yet, okay? They're just a potential reservoir, a potential home. Now, the second group, when we're talking about people, are people who are infected and they're obviously sick. So I have a microorganism, I have a germ, and I have symptoms related to that germ. The third group are people who are carriers, but they do not show symptoms. So what's important to remember about this is, because they are not sick and you don't know they have the infection, they are still carriers and they can still pass along that infection to others. Another way to think about this is to think about infections in terms of an iceberg, right? So people that we know have the infection and can infect us are the tip of the iceberg. If you've ever seen a picture of the iceberg, you see the tip above water. If you're to see the iceberg underneath, it's massive, right? So the people who are carriers, who we don't know are infected but could possibly infect us, are the iceberg underneath the water. And this is why it is key to treat every single person as if they are carrying a germ. And this is when we're not going to get there yet, but in a few minutes, this is when standard precautions and then transmission-based precautions are going to come into play. But let's continue on first with the links of the chain of infection. So the third link is the portal of exit. This is any way or any route that harmful germs can escape from the reservoir. Some examples, we have our nose and mouth. So if we cough, we spit, we have mucus, it can spread that way. Our GI tract, if we throw up, if we pass stool, right? Those are different ways that germs can leave our body. On our skin, harmful germs leave through direct contact, and that can be in blood, pus, or any other kind of liquid that may have some drainage from our skin. The fourth link is the mode of transportation. So mode of transportation, just like it sounds, this is how a germ travels from one place to another. The number one way that harmful germs travel, or any germs travel, is on our hands. So that's why one of the first skills that we learn is proper hand hygiene. It is the number one way to prevent the spread of infection is proper hand hygiene. So like I mentioned, one way harmful germs travel is by direct contact with body fluids where germs live, such as blood, sputum or mucus, pus or wound drainage, saliva, stool, vomit. And there are different ways that we can be exposed to this. Needle stick, so if you accidentally get stuck with a needle that has another person's blood on it. Contact directly with skin when someone has a rash or a cut or a scratch. If body fluids splash into our mucous membranes, which is, our mouth or our eyes, for example. But harmful germs can also be passed on by indirect contact with body fluids where the germs live. And some examples of this, let's say you have harmful germs on your hand and you haven't done hand hygiene yet, and you go touch a piece of medical equipment. Then you leave, and shortly after that, your coworker comes up and then handles that equipment. So now you have had this indirect contact with these harmful germs, and they have spread. Now, there are a few other ways that harmful germs can get around. This can be through insect bites, animal bites. You can also get it from eating or drinking food or water that is infected with harmful germs. All right, the fifth link is the portal of entry. This one's easy to remember because it is the same as the portal of exit. So any opening in a person's body that allows germs to enter and exit can be the portal of entry. Germs can usually get in the same way they get out. So like I just mentioned, portals of entry are also portals of exit. Some examples, the nose and mouth, the GI tract, breaks in the skin. And then the final link in our chain of infection is the sixth link, the susceptible host. A susceptible host is a person who does not have an infection now, but is at risk for becoming the next person to get infected from a harmful germ. A susceptible host is a person whose body, for whatever reason, and we have different reasons, can't fight off infection. So some reasons why a person's body might not be able to fight off infection include age, chronic illness, not being vaccinated, open cuts in the skin or skin breakdown, being overly fatigued, poor nutrition, or excessive stress. So residents who live in the long-term care facility are more likely to get infection than other people who live out in the community. And there's a variety of reasons for this as well. Often people who live in the long-term care facility have several things wrong with their health. So they have diabetes and congestive heart failure. They may have kidney problems. So not always, but oftentimes they have multiple health conditions. Many of them are elderly, and they're more likely to come in contact with harmful germs because of the close quarters that they live in and because they share staff and equipment. So how does the chain of infection relate to our work as nurse aides in the long-term care facility? Well, as a nurse aide, we have a huge responsibility to protect ourselves, our family members, and our residents and their family members as well. We work in an environment that encourages infection. So the people we care for are generally elderly, sickly, and more susceptible to disease. What might just be a cold for us can actually be deadly to the older adult. So it's important to remember that as nurse aides, we play a huge role in preventing the spread of infection. If we can break any one link in the chain of infection, that new infection has been prevented. And we have a lot of chances throughout our day to break the chain of infection. So again, if you can break any link in the chain, you have prevented an infection. Some examples of how we can break the link in each of the stages, or in each of the links, I should say. In the first link, we can break that link, it's the infectious agent, by getting immunized against the flu, for example. The second link, the reservoir, if we're sick, we stay home. If we're the home for the germ, we're going to stay home so that we're not spreading it. The third link, with the portal of exit, if we cough or sneeze, covering our mouth and our nose and then washing our hands properly after. The fourth link, the mode of transportation, washing our hands. Like I mentioned, that's the #1 way we can do it. The fifth link, the portal of entry, if we have a cut or a sore or a wound, making sure that it's clean and covered. The sixth link, the susceptible host, we can break that by not making ourselves susceptible hosts, for example. So that's keeping ourselves healthy, eating a proper diet, getting enough sleep, etc. Healthcare-associated infections. This is a term that you want to be familiar with. This is an infection that the resident gets while staying or living in a healthcare setting. And this is something that they did not have when they first came into this healthcare setting or facility. It's something that they acquired while they were in that setting. That's what makes it a healthcare-associated infection. The CDC is the Centers for Disease Control and Prevention. It's an agency of the federal government in charge of the control and prevention of disease in our country. So the CDC works to protect the public by keeping members of the public healthy and safe through education. And it was the CDC who developed a two-tiered or two-level way to prevent the control of infections in healthcare. And this is where standard precautions and transmission-based precautions come into play. And let's talk a little bit about what these are. So standard precautions are the first level to prevent and control infections. These are the basic tasks that healthcare workers must do when caring for each and every resident in order to prevent and control the spread of infection. So standard precautions treats all body fluids, all non-intact skin, and all mucous membranes as if they were infected. Think back to that iceberg we were talking about. Because you don't know how many people could potentially be infected, we have to treat everyone as if they are. Let's real quick, we're going to review a couple of terms before we continue talking about standard precautions. So recall body fluids can include blood, pus, liquid from sores, urine, stool, tears, saliva, droplets from sneezes and coughs, and sputum from things that you cough up, as well as emesis or vomit. Non-intact skin includes cuts or scratches and sores that may be oozing different fluids. Mucous membranes, just to make sure you understand what those are the linings of any of our natural body openings. So that would be like our eyes, nose, mouth, rectum, or genitals. So again, why are standard precautions so important? We have to use them with every single resident every single time. Because there are residents you provide care for who have infections that no one knows about, without standard precautions, we can get that infection and pass it along to others. So following standard precautions prevents us, visitors, family, co-workers, and residents from getting infections. And we've mentioned several times already how important proper hand hygiene is. So hand hygiene is defined as washing hands with either soap and water or alcohol-based hand rubs. Washing hands with soap and water has probably been a lifelong habit for most people. Alcohol-based hand rubs are fairly new, and it's important to know that when we wash our hands with, or clean our hands, I should say, with the alcohol-based hand rubs, we need to make sure that we're getting a sufficient amount of the liquid or gel or foam into our hands so that it takes at least a full 20 seconds to rub it all the way in and be dry. If it doesn't take that long, we're not using enough of the gel or rinse or foam. So let's talk a little bit about hand hygiene. So hand washing, again, is the #1 way to stop the transmission of infection. Therefore, performing hand hygiene is the single most important thing that we can do as nurse aides to prevent the spread of infection. So when do we wash our hands? When do we do hand hygiene? There's a lot of times at work when we should be performing hand hygiene. And oftentimes they say we do it at the point of care. Well, what does that mean? The point of care is when there are 3 elements happening together, and it's pretty simple. Anytime you have a resident or a patient, a nurse aide, and any kind of care or treatment that involves contact with that person, those are times when we need to be performing hand hygiene. Most of the time, these types of things are going to be occurring in the resident's room or bathroom, but there are times when it occurs out in other places in the facility. The World Health Organization recommends that during healthcare delivery at the point of care, like we just mentioned, there are 5 essential times or moments that the nurse aide must perform hand hygiene: before touching a resident, before performing a clean or aseptic procedure, such as brushing teeth, feeding a resident, getting clean linen, after any body fluid exposure risk, for example, after you've brushed teeth, after you've cared for any kind of little cut or skin lesion, after you've cleaned up any kind of body fluid or handled a bedpan, for example. Number 4, after touching a resident, for example, you've just taken their vital signs or you've just helped them get dressed and prepared for the morning. And number 5, after touching a resident's surroundings. So you just changed their bed linens, you lowered their handrails, you just cleaned off their bedside table. These are all essential times when we're washing our hands. Another good little saying to remember is wash in, wash out. So anytime you're about to go into a resident's room or a patient's room to assist them in any way, wash your hands, use some of that gel, hand foam, hand sanitizer. And then again, when you're getting ready to finish with that patient or that resident, wash your hands again before you leave. We perform hand hygiene as soon as we arrive to work, after we use the bathroom, after we eat. Every single time you remove a pair of gloves, you wash your hands. Before you touch clean linens, definitely if your hands are soiled, after you've handled trash, or after you've touched or handled objects or people. We're also, of course, going to be doing hand hygiene if we clean up any blood or body fluids, before and after using any shared medical equipment. Before we leave work, you're going to want to make sure to wash your hands when you return home. We also want to make sure to use hand hygiene after we blow our nose, sneeze, if we touch different parts of our body, our hair, and after handling trash. Now, there are particular times when it's appropriate to use hand washing and the alcohol-based hand rubs or foams or gels. We need to wash our hands with soap and water if they are visibly dirty, after we've used the bathroom, after we've blown our nose or sneezed. It's okay to use the hand alcohol-based rubs or gels before we are handling food, like if we're going to pass out trays, it's okay to use hand gels. If we're just doing routine resident care, like helping them get from bed to wheelchair or get dressed for the morning, it's okay to use the alcohol-based hand rubs or gels or foams in those instances. Now let's talk about personal protective equipment. So personal protective equipment, or PPE, is a group of items that nurse aides use to block harmful germs from getting on our skin and clothes. This is what the nurse aide puts on at work to keep blood, urine, stool, saliva, or other body liquids off of our skin and clothes. So the type of PPE, the nurse aide wears is going to depend on what we're doing, what kind of contact there may be with blood and body fluids and non-intact skin, and whether the person is on transmission-based precautions or not. And we will be talking about those transmission-based precautions shortly. So personal protective equipment. PPE includes gloves that protect the skin. So we're going to use gloves when there's a possibility of contact with blood or body fluid, non-intact skin, or mucous membranes. We're always wearing gloves during mouth care, wiping a resident's nose, doing pericare, caring for any kind of sore, or shaving a resident. PPE can also include gowns that protect our skin and clothes. These are worn when there is a chance that blood or body fluids may go beyond the gloved hand. Personal protective equipment may also include masks or goggles or a face shield of sorts. These are worn when there's a chance of breathing in harmful germs through the nose or mouth, or if we need to protect our eyes in case we're concerned there could be a splash of body fluids that could get into our eyes. And again, we're going to talk more about transmission-based precautions in a few minutes here. But we're going to go ahead and talk about sharps for a moment. So what are sharps? Sharps are any item that has a corner, edge, or projection that could cut or pierce your skin. This could be a needle, it could be a razor blade. And the key with sharps is safety. Safety, safety, safety. We always wear gloves and use very careful handling when we're using, or be careful handling any kind of sharp, especially when it could have touched blood or body fluid. We want to be careful not to cut ourselves or resident when we're shaving them, and we want to be careful not to jab ourselves with any kind of sharp. Something to remember is we never, ever recap a needle. I'll show an image here. So this is an image. If you were working in the hospital or long-term care facility and you happen to see a needle and a cap lying aside, I hope you never do, but we never want to recap a sharp. There's too much risk of sticking ourselves when we're doing this. You never want to put a sharp, any kind of sharp, into a regular trash can. This is obviously a very high risk of someone getting stuck. We always want to put sharps in a sharps container. This is a special container. It's a biohazard container used for the disposal of sharps. It's hard, it's leak-proof, and it's labeled with the warning that the contents of the container are harmful. There's a few things when we're using sharps containers to remember. Never ever stick your hand or fingers into the sharps container. You can see that person is just hovering over that opening. That person's going to drop that sharp into that area, and it will do an automatic tilt and drop that sharp into the container below. You never ever try and just cram one more needle in there, and you never overfill a sharps container. There's going to be a mark on the side of the container that shows full. It's always going to be 3/4 full. You never overfill it. You dispose at that point. So spills on the floor. So we want to clean up spills based on procedures listed in the facility's infection prevention policy and notify housekeeping if necessary. In general, for needing to clean up spills, we need to put on gloves, absorb the spill, clean the area around with the correct product, and make sure you're always following the directions on the label. If appropriate, and we need to use a biohazard bag to dispose of anything, if it's blood or body fluids, we want to make sure we're doing that. Disinfect the area and place a warning cone or sign so that others will know that the surface is wet and to avoid it. So why are spills on floors, especially those involving body fluids, especially dangerous in the long-term care facility? Well, if you think about it, in the long-term care facility, we have an increased risk of falls already just due to age and health conditions. If we have a spill on the floor, that's an increased risk of someone slipping and falling because of a wet surface. And then also, if it's a body fluid, we've got an increased risk of infection. If there are spills on surfaces, you, of course, similar to on the floor, but we want to clean the surface with the product that is approved and used by the facility. You want to make sure to follow all facility procedures and product instructions very closely. There are certain surfaces that need to be cleaned regularly, or at least after every resident. That's going to be wheelchairs, countertops, utility rooms, and shower chairs. And now let's talk about transmission-based precautions. Like I mentioned, there are standard precautions, that's the first level of protection, and then there's transmission-based precautions. These are the second level to prevent and control the spread of infection. Specific tasks and measures must be taken when we care for residents who are infected or may be infected with certain types of infections. So nurse aides need to follow standard precaution rules to protect ourselves, our coworkers, and our residents from getting sick. There are 3 types of transmission-based precautions that you need to know. There are contact precautions, droplet precautions, and airborne precautions. And we're going to talk a little bit about each one of these so that we know what they are. Contact precautions. So the purpose of contact precautions are to prevent the spread of harmful germs that are spread through direct contact. We're going to follow standard precautions, but we're also going to be wearing a gown and gloves. Some examples of germs that spread through direct contact that we need these for, MRSA, which you may have heard of. This is a methicillin-resistant Staphylococcus aureus, or the norovirus. The norovirus is a GI virus that causes pretty significant diarrhea and vomiting. Droplet precautions. The purpose of these precautions are to prevent the spread of harmful germs that travel by droplets in the air. Some harmful germs, like the flu, can be spread or travel by way of droplets. Droplets spread after being sprayed from our nose and mouth, like when we cough, when we sneeze, when we talk, laugh, or sing. So droplets themselves might land directly on another person, in which case it would be direct contact, or they could land on a doorknob or a rail or another surface that I might come around later and touch. That would be that indirect contact. Droplets typically don't go any further than 3 feet. And again, they spread when that sick person coughs or sings or sneezes or even just talks. So we're going to, of course, follow standard precautions for this, but now we're going to be wearing our mask as well. Some examples of droplet, influenza or flu, and the whooping cough. So that was airborne. Now that was droplet. Now we're going to talk about airborne. Airborne precautions prevent the spread of harmful germs that travel in the air at a longer distance. So droplets go in the air, but they can only travel so far. They're heavier. Airborne germs can go for much further. They can actually even float around in the air for a while. They can be carried by moisture, air currents, or dust. So we're going to follow standard precautions, but we're also going to need to wear a special mask called a respirator. You may have seen those lately with COVID, especially sometimes depending on where you're working, you may have to wear an N95 respirator. Some examples of when this needs to be used is someone who has tuberculosis, chickenpox, or measles. A term you want to be familiar with is the outbreak. This is when more illness in more residents than what is expected or what is normal for the facility occurs. So you could have an outbreak of the flu, for example, in the nursing home, where more of the residents than typical than is expected get the flu. Another example is the norovirus. This is a healthcare associated infection, right? So the nursing home, you've had an outbreak, they got this infection because they're in this facility. It's important to remember that influenza or flu and the norovirus are very dangerous for people 65 and older. Speaking of the flu, again, this is a respiratory infection that is more risky for people 65 and older. They're more at risk for serious complications and death from the flu than when compared with young, healthy adults. 90% of flu-related deaths and more than half of flu-related hospitalizations each year occur in people who are 65 or older. Getting your yearly flu vaccination is the first and most important step in protecting against the flu. It's important to know that healthy older adults may be able to infect others one day before your symptoms actually start, and for 5 to 7 days after you become sick. So if you have a fever and respiratory symptoms, make sure you don't come to work until the fever has been gone for at least 24 hours, without the use of medication. And that's because if we're using medications that reduce fever, it's masking that fever. So we are still contagious. So again, 24 hours fever-free without medication. Also, of course, encouraging everyone residents, employees, visitors, etc., to practice good hand hygiene and to cover their mouth and nose when coughing or sneezing. This is going to prevent the spread of infection. And when we're talking about flu, as we just mentioned, we're going to be following both standard and transmission-based precautions. We mentioned the norovirus. This is a gastrointestinal or GI infection. Dehydration can be a problem for the elderly, and they need to help them make sure they're replacing fluids. Oftentimes we can replace fluids through liquids and foods, but sometimes when the older adult gets the norovirus, they may need to get intravenous fluids to replace. Most people get well within 1 to 2 days of contracting the norovirus, but it's important to remember that you can be contagious until at least 3 days after vomiting and diarrhea have stopped. This is different than your typical GI bug. With other GI bugs, usually once you've been vomiting or diarrhea free for at least 24 hours without medication, it's okay. But with the norovirus, we need at least 3 days after vomiting and diarrhea have resolved. Nurse aides who have symptoms of the norovirus should stay home from work until at least 2 days after symptoms have resolved. Of course, with this one, we're going to follow hand hygiene, but it's important to know norovirus, alcohol-based hand rubs are not able to kill the norovirus. So this is an exception to where we have to use hand hygiene with soap and water. If someone is on transmission-based precaution and they're suspected of having or confirmed to have the norovirus, their transmission-based precautions will include a sign that says, must use hand washing, just so you know. So always be observant of the signs on the doors. There's not a vaccination for the norovirus, so we just have to practice good hand hygiene, infection prevention, and follow standard and transmission-based precautions. Now we're going to talk a little bit about bloodborne infections. When we talk about bloodborne infections, these are harmful germs that are found in human blood that can cause infection or disease. The 3 most common bloodborne pathogens are hepatitis B, hepatitis C, and the human immunodeficiency virus, or HIV. Residents can get an infection from bloodborne pathogens by sharing contaminated needles, by sharing contaminated finger stick devices like blood glucose devices, or from direct contact with blood from an infected person. And of course, we can get, as healthcare providers, exposed and infected if we accidentally stick ourselves with a contaminated sharp, or again with direct contact. Bloodborne pathogens, hepatitis B virus is a disease of the liver. It's important to know with hepatitis B that about 1/3 of people infected with hepatitis B virus do not show symptoms. It's also really important to know that hepatitis B virus can live outside of the body on equipment and surfaces for 7 days, and it can infect others throughout that whole time, that whole 7 days. There is a vaccine available to prevent you from getting the disease. That's why it's important that we make sure we're vaccinated against hepatitis B. Hepatitis C is also transmitted through blood and body fluids, but there is no vaccine. There are treatments for people who get hepatitis C, but the best thing, of course, is prevention and to be safe and try not to get exposed. Always wear gloves when there's a chance of exposure to blood. Handle used sharps carefully and make sure you discard them appropriately. We always follow our facility's exposure plan if any part of the body is exposed. When we have been exposed to blood or body fluids, we want to wash the area immediately. That is the first step, wash the area immediately. The second step is then to report that exposure to your nurse or supervisor. Third step is to complete an incident report. And fourth step is to follow the procedures for testing and treatment per your facility's policy. All right. So we're going to look at these pictures and just review what is going on. So in this picture, of course, the problem is that they are not disposing of sharps properly. They're putting it in a regular trash can. They should be putting it in a sharps container. In this one, of course, the recapping of the needle is not correct. We never want to do that. It's too high risk for jabbing ourselves. This image, this person is wearing a contaminated glove and touching different surfaces. In this image, this contaminated glove is being brought up to this person's face, which is not a good idea. And that actually concludes our lecture on infection prevention, Module B.